evening. My name is Aide Mendoza, and I'm doing this self-introduction video for my class, Nursing in the Community 4503. Currently, I am working in a psychiatric hospital, and previously to this job, for many years, I worked in long-term care. When I was checking the objectives of this class, the syllabus, I was questioning myself about the role that I could have in the community while I am working in a psychiatric hospital or in a long-term care facility. And I could notice that I can incorporate the levels of prevention in both the psychiatric hospital and in the long-term care facilities. For example, when we get an admission, besides doing a psychiatric evaluation, part of the admission is to do some lab work. And some of those labs, in addition to a CBC or a CMP, are labs for STDs, for sexual transmitted diseases. Many of the patients that have mental issues get involved in risky behaviors, like having unprotected sex. So, and that put them at risk for STDs. So when they get to the psychiatric hospital, they have those labs done for them. And if they find any STD, they are referred to a medical doctor. So that is early prevention for the illness. Also, they when they are admitted to the hospital, they have the TB test, and if they found they have tuberculosis, they make more screenings, and they have the illnesses there, they are referred to the medical doctor. In regard to that is like a secondary prevention. In regard to the nursing homes, I could notice that in the nursing homes, the focus is in a tertiary prevention. Many of the patients in the nursing home, they already have a illness. They have like diabetes, hypertension. Some of them had a stroke, so they already had a problem, a disease. So the focus in the nursing homes is to try to give rehabilitation or try to give a better quality of life for those patients. Try to manage the symptoms for the disease, to have a better outcome for the disease. That is a tertiary prevention. Also, I could notice that with the families, many of the families in the nursing homes, they spend a lot of time in the nursing home with a family member, and some of them question the nurses or about the illness that is the father or the mother is suffering, because they worry about because many of those illnesses are genetic diseases. So they worry about if in the future they're gonna get diabetes. So one of the roles of the nurses in the nursing home is also give teaching to the family members about how to prevent those problems, like diabetes prevention, what to eat, or what to have more exercise, more activities, and also refer them to have more screenings so they can detect if they have a prediabetes. They can act in the moment before they get the problem. So those are the roles that I could detect that we can do in the psychiatric hospital or in a nursing home in regard to the community. For this class, for nursing in the community, I expect to learn more, get more knowledge about how to help the people in the community as a nurse. Also, learn tools and how to implement my knowledge to try to improve the health in the community. Thank you, class. I hope that that you get the best for this class, and I hope to interact with some of you during the discussion boards. Thank you.